Everybody. We're gonna get started. Thank you all for coming. My name is Rob, and I'm M2 at Mayo Clinic School of Medicine. I'm part of the Pathways and PM&R leadership team along with Connor. Uh, Today, we're lucky to have a couple of great speakers from the Mayo Clinic Sports Medicine Department. It's Dr. Negron and Dr. Hasley. Dr. Negron and Dr. Hasley are the two sports medicine fellows at Mayo Clinic Rochester this year, and they're extremely knowledgeable about both the field of sports medicine as well as the process of applying to physiatry and sports medicine programs. They prepared a presentation for us tonight, so with all that said, I'm going to let them take it away.
Thank you, Rob. I want to thank Rob, Hunter, Pathways and PM&R for inviting us to chat with you all. I'm here with Ike Hasley. We'll be presenting you guys a perspective or PM&R, but also with the flavor of sports medicine. I'm really excited to be chatting with you all. To begin, we'll kind of share what the agenda is for tonight. We're going to be going over some introductions of myself and Ike. And the introductions are going to kind of like portraying a chronological from undergrad to sports medicine fellowship of what we're doing now and how we got there. We'll touch base on what is PM&R for folks who are generally interested for physical medicine and rehab, and what is PM&R, the specialty, but also what is the residency like. We'll also talk about the sports medicine fellowship aspect of things. We'll have a tips slide to give you some tips, which I would have appreciated when I was applying to PM&R. And then we'll end with a Q&A session, and it'll be an open floor to discussion. So as an introduction to myself, I'm Georgia Negron. I go by Gio, so you guys can call me Gio. I went to University of Florida for undergrad. I did my major in biochemistry. I took a gap year between medical school, and I actually, Did something happen here?
Looks like the PowerPoint went away.
Huh. I don't know what just happened.
Yeah, I'm just not seeing your screen share right now, Gio. I still hear you and see you.
For some reason, I can't see my PowerPoint. Give me a second.
Let me see if I can pull it up.
Oh, I see it. Can you guys see it now?
Yeah, we can.
All right, perfect. Let's see here. Can you guys see the screen?
Yeah, looks good now.
All right.
You're in presenter mode. You might have to flip the screen.
Is that fine?
Yep, there you go.
All right, it's on presentation mode now?
Yeah, I think it's good.
All right, perfect. Well, okay, so hopefully we can edit that. So we're going to be talking about my introduction. Basically, I did undergrad at University of Florida. I did a major in biochemistry. I took a unique sort of gap year, as you say, went back to Miami, where I'm from, and I managed a company called Team Wireless Unlimited. This was a company that actually my father ran. It was a cell phone repair store business. It was very, honestly, a great experience. Do not regret it at all. And it was just a fantastic sort of a breather from college, from biochemistry, but it was applying to medical school. Did get into University of Florida, stayed there for quite a long time, did my intern year there. So the way that PM&R works is it's a 3+1. So you have physical medicine rehab as a 3-year program, and you have your intern year, either going to be in internal medicine or surgery intern year, or even a transitional year. And now I'm doing my fellowship at PM&R Sports Medicine at Mayo Clinic in Rochester, Minnesota.
All right. Yeah, thanks, Gio. Appreciate you getting this together along with Robin Hunter. So like Gio said, my name is Ike Hasley. I grew up in Cedar Rapids, Iowa. Attended undergraduate at St. Louis University down in St. Louis, Missouri. I majored in health management and policy. Came back home for for med school at University of Iowa. Kind of like Gio, I did a intern year in internal medicine. You can do a transitional year as well, but both of us did internal medicine, and so that was at the University of Iowa's Des Moines campus. Then did physical medicine and rehabilitation at Mayo Clinic in Rochester, Minnesota. And then I'm doing my fellowship in sports medicine at Mayo Clinic in Minneapolis, Minnesota. So the programs that Gio and I are in for sports medicine right now, they're kind of like sister programs. I'm an hour north of where he is at up in Minneapolis, but I'll go down there frequently to kind of the big house and help with teaching the residents some musculoskeletal physical exam and ultrasound stuff.
All right. So let's start off with what is PM&R? So first of all, let's start off with what is a physiatrist. So as a cardiologist, as you know, is a doctor of hearts. A physiatrist is a doctor in PM&R. So physiatrist, I really like the quote that the Association of Academic Physiatrists have on our field is a physiatrist is a medical physician who emphasizes the prevention, diagnosis, treatment, and rehabilitation of people disabled with disease, disorder, of injury. It really is a catch-all term in that we treat patients with any sort of disorders, any sort of diseases that causes disability in their lives. So who do we treat? Essentially, we treat the whole gamut of patients, again, who fits that criteria of a disability, but not only disability, injuries, anything that's causing a dysfunction, and we are there to help either treat, cure, as well as facilitate a good quality of life. So the conditions that we treat, from traumatic brain injuries to spinal cord injuries to orthopedic traumas, we even treat patients in the pediatric realm with cerebral palsy. We have patients who suffer from neuromuscular diseases, Parkinson's diseases, spasticity, movement disorders. And then you kind of transition into what we call the physical medicine aspect of things, and that's the sports medicine, the pain medicine. So in general, it is a very broad specialty, and our goal and our aim is to restore functional ability, independence, and quality of life. So one thing that as a physiatrist we're really proud of is that we have a tremendous skill set. So we are very skilled in performing musculoskeletal and neurological examinations. It is a common encounter as a PM&R resident, as a graduate PM&R resident, that we are asked consistently to teach musculoskeletal and neurological examinations as a fellow teaching residents, but also teaching medical students. We're interdisciplinary team leaders. We have a portion of our training in inpatient rehab, and essentially that is working alongside with in a rehabilitation setting, alongside with therapists such as physical therapists, occupational therapists, speech language pathology, from neuropsych services to the nurses. It's just a whole interdisciplinary approach to treating a patient in inpatient rehab. And then we're also proceduralists. In our residency, we get trained in various procedures, or get at least exposure to these procedures. Most notably, we get trained in EMGs, or electromyography. We basically have, just like again, the cardiologist reads EKGs, we read EMGs. We do nerve conduction studies. Alongside that, we also do procedures like ultrasound guided procedures, fluoroscopy guided procedures into the spine or into even joints, nerve stimulators. We do spasticity treatments with phenol or botulinum toxin injections. Prosthetic orthotics is also our bread and butter. And then we utilize these procedures that we do essentially to, again, go back to what we're known for, is the quality of life, to help a patient achieve a good quality of life. And that's either from improving their pain, improving their function, and whatnot. So talking about the PM&R residency first, PM&R is once you're applying as a medical student, you're going to realize that it's two separate ACGME matches. And as Ike and I was saying, we said before, you start off, it's a 3+1 or 1+3 kind of program. Essentially, you are applying to an intern year, either in internal medicine, surgery, or a transitional year. And then you also have a separate match to the PM&R residency. Again, the PM&R residency is a mixture of inpatient, which is primarily the inpatient rehab setting, outpatient clinics, which can start from general musculoskeletal, from sports medicine, pain medicine, spasticity clinic, to consult service. So me coming from Emory University in Atlanta, Georgia, I did my PM&R training there, and my whole residency was dispersed throughout Atlanta. So I had exposure in the inpatient rehab setting at Emory Rehab Hospital, and I also had a specialty hospital in spinal cord injury, which is the Shepherd Center. They did spinal cord and traumatic brain injury. Clinics and sports medicine, and then as well as did perform my EMG studies there. And then finally, for consult service, I was in an acute level 1 trauma center, Grady Memorial Hospital, doing PM&R trauma consults. Essentially, they would consult us for handling patients for management of traumatic brain injury patients, spinal cord injury patients, orthopedic traumas services. It was just very, very just a broad but amazing specialty to kind of get those all little exposures on. And then as one graduates from PM&R, you have the ability to just try to graduate as a general physiatrist, doing a little bit of everything, but you can also subspecialize. And subspecializations, it's really more for like going for a fellowship. So you can subspecialize in neuromuscular medicine, interventional pain medicine. You also have a specialty that's called interventional sports and spine. It's a mixture of kind of both worlds of sports and spine, but it's a non-ACGME accredited fellowship. Then you also have pediatric rehab medicine. That's a 2-year fellowship program. Spinal cord injury medicine, palliative medicine, and then finally sports medicine. All that being said, all the subspecializations take 1 year, except the pediatric rehabilitation medicine fellowship is 2 years extra from the PM&R.
All right, so I'm going to talk a little bit about sports medicine itself. So like Gio said, most of these fellowships are a 1-year fellowship, and that includes sports medicine. There are a couple of programs out there that are moving towards like a 2-year program. And this can be, one year might be a little bit more research heavy. It really just varies by program, but there are a few that are out there, and it seems to be becoming a little bit more popular. And so if you are very interested in, staying at a certain program or a certain geographical area, or you really want to be in academic medicine with a focus on research, these might be a good option for specific individuals. But by and large, most of these are a 1-year ACGME accredited fellowship. Certain programs, when you're looking at sports medicine itself, certain programs may require or they may prefer certain specialties. And so the common primary care sports medicine fellowships are usually, the majority of them are family medicine based. A lot of them are pediatrics. They might be like a pediatric specialization. Emergency medicine is a popular residency field that feeds into sports medicine. And then also PM&R itself. I know that there's some people who did internal medicine training and then went to sports medicine. I think this is a little bit more rare, but certainly possible. And so even within this, you've got your orthopedic surgery sports medicine specialists who do 5 years of orthosurgery, and then they do a year, usually a year of sports medicine. So that's kind of the surgical aspect. And then on the other hand is the primary care non-operative sports medicine fellowships. And so even within those primary care or non-op sports medicine fields or fellowships, everyone can be a little bit different. So the way that Gio and I have, the way that our fellowship is set up is there's 2 different fellowships, and they only take PM&R trained candidates. Other places might have 1 spot for family medicine, 1 spot for emergency medicine, 1 spot for PM&R. Other people might take 2 candidates per year, and they have a history of taking PM&R and maybe family medicine, or PM&R and their emergency medicine. You know, they might take 2 family medicine applicants in 1 year. And so that's something that you just kind of have to do your own research on as you're going through. You know, if I really want to be out in New York and I really want to apply to this program, but they haven't taken many PM&R applicants in the past, that's something to just kind of be aware of, and you'll kind of cross that bridge when you get to it. But I think the big takeaway on that bullet point is that a lot of different places can have different setups, and you really just want to find a place that's a good match for you. Even within those different programs, they might emphasize certain different aspects of sports medicine. So the programs that Gio and I are very ultrasound guided, procedural based, whereas another program might have more emphasis on perhaps sideline coverage. They might be specialists in fracture care. They might see a lot of athletes with spine pain or back pain. And so that's something to kind of ask about and kind of ask yourself about, as well as what area within sports medicine do you really want to specialize in. And that just kind of is a testament to how broad and how diverse the field is. You know, there's a ton of different aspects within PM&R that you can really go, whether it's pediatrics, brain injury medicine, amputee and orthotics. I don't know if we really hit on that one very much, but that's also like a non-accredited fellowship that you can go into. So even within PM&R, there's these really broad, diverse aspects that you can get into. The same can be said within sports medicine itself. Next slide. Yeah, palliative care as well. Thank you.
So a couple tips, honestly, that we try to just think about some tips for if we were in your shoe, when we were in your shoes, as we're going into our journey into PM&R and ultimately sports medicine. I just try to make sure you get some PM&R exposure. Personally, when I was a medical student, my medical school did not have a PM&R residency associated with it. They had a PM&R rotation, which I was eager to kind of participate in, but it was really shadowing the PM&R attendings. I did not interact with any residents. I didn't see how a PM&R residency works. So I pursued an elective rotation. So I did an elective rotation and got my exposure in how a PM&R residency works, how the residents kind of go to different rotations, their perspective on things, how do they do their procedures. And I got a lot of exposures, and ultimately these are exposure is key when you're trying to get letters of recommendation. Find a mentor. So a mentor, primarily, if you can find a mentor in PM&R, that would be the best. But a mentor is generally can expand from graduated students who went into PM&R to PM&R residents that you've had exposure with during your rotations, as well as attendings. Those are going to be kind of key people in your journey to PM&R, as they can kind of help you and make you actually see the road clearer. It can give you some tips on trying to go through obstacles in PM&R in the journey of PM&R, especially when you're doing applications, letters of recommendations, programs to apply to. Again, like Ike was saying, geographically, there are some programs that are certainly can specialize in a certain aspect of PM&R, but if they're not geographically, if they're on the other side of the country, are you willing to kind of move there? Those are questions that you need to ask yourself, especially during those interview cycles. join a PM&R interest group. Unfortunately, there wasn't a PM&R interest group at my university. However, I've seen multiple medical students kind of like start one and start an interest group. And it's just a fantastic approach to kind of getting a lot of exposure for the medical students there. And finally, join a national society. Societies such as the AAPM&R and the AAP are great for medical students. And then I didn't note this, but if you're interested in sports medicine as early on as a medical student, you can even try to join into the sports medicine societies like the AMSSM. That's the American Medical Association of Sports Medicine. So that would be sort of a great opportunity to submit even a case abstract, see if you can present a poster, participate in lectures and learn about our field. But that'd be sort of that in itself is something that I did as a medical student, and it was very, very, very helpful. So finally, we're going to end our discussion with a Q&A, and we'll stop sharing here. If we have any questions.
Yeah, thanks so much, guys. This was fantastic. Thanks for kind of showing the breakdown too of different steps along the way of applying for residency and for intern year and things like that. I was kind of wondering about if you have any tips for identifying like certain residency programs and trying to identify like what they kind of specialize in, and figuring out like what most people from their school end up going into as far as like fellowships and career paths and things like that.
Yeah, I can add that as question first. I think one of the key things to look at when you're looking at programs is their fellowships that they sometimes have. The fellowships can kind of clue you in on what kind of faculty members are there. So for example, my home program at Emory University, they have sports medicine, they have interventional pain, they have sports and spine, pediatric rehab, spinal cord injury. Now they just started a traumatic brain injury fellowship. All that tells me is that they have a whole bunch of faculties in all those aspects of PM&R. So in general, like that would be kind of, it clues you in. Obviously you can look at the website, you can kind of read sort of between the lines of like, okay, this is a hospital of a model system hospital for spinal cord injury. There's a model system hospital for traumatic brain injury, and our residents get to work in these hospitals. So those are kind of really great exposures. If you want to go into an inpatient side, you can also look at the procedures that, or at least during the interviews, you can ask what kind of procedures they do, the procedure exposures, the procedure numbers, and see if they even have incorporations of particular curriculums, such as some programs emphasize a lot of ultrasound learning. So they sprinkle in a lot of in the curriculum ultrasound didactics and ultrasound hands-on ultrasound course throughout the PM&R residency. And that can be kind of found, you can find that out during the interview process. Sometimes they can find that out in the website.
Awesome. Thanks, man.
Hi guys, so thanks for the talk today. I have a question in terms of sports medicine as a fellowship. I know that multiple specialties compete for fellowship spots. So does that make the fellowship sort of competitive when applying to it? And my other program was for sports medicine programs. How do I know or what does each program emphasize, for example, in terms of fracture care or sideline coverage, etc.?
Yeah, I can take that one, Gio. So yeah, it's definitely a competitive field. There's a lot of different people from a lot of different specialties applying. And I know the numbers are out there somewhere in terms of how many applicants versus how many spots. You know, that's also the nice thing about it, is that some, like we were saying, some fellowships really only take PM&R applicants, whereas others might take a variety of applicants. And so I think that each kind of resident specialty has a number of programs that only take that resident specialty, whereas other programs, you know, might take kind of all comers. But that being said, I think specialties, fellowship specialties in general are pretty competitive. So it's certainly common for, some people to do a gap year after residency as well, if you will. And so in terms of figuring out what fellowships really emphasize what, you kind of get a feel for that. Like Gio was saying, you talk about procedures, and while you're interviewing, you ask certain questions to say, how much ultrasound exposure do I really get, or how much time am I spending in the fluoroscopy suite? And so that's kind of something that you get a sense of as you go along. I know that when I was applying for residency and for fellowship, there was kind of some documents or like Google Sheets floating around, maybe on like student doctor network, which, always take that information with a grain of salt. It's kind of easy to psych yourself out looking at all these people getting all this information together. But you can certainly use that to your advantage. So I remember that certain residencies would say, is this place an inpatient heavy residency or an outpatient heavy residency? And there's similar information about fellowships as well. Also, the more you get involved, with those national networks, whether it's PM&R, like AAPM&R or AAP are the big academic PM&R networks, AMSSM and ACSM are the big sports medicine national committees or organizations. The more you get involved with that, you're seeing people at conferences, you're talking to those mentors that Gio mentioned, you get kind of a sense of, oh, this place does a ton of fracture care because they're, up in the mountains of Colorado or Utah, versus like a place like Mayo, we're kind of known for our ultrasound. And so you kind of just get a sense of that as you go along. So it's certainly not something that you have to be really up to date on as medical students. I think that if you kind of follow those tips that Gio was talking about earlier, get involved, find some friends that are also interested in the same thing, find some mentors, you kind of get a sense of that as you progress just through your medical training. So I hope that answers that for you, Emma.
Yeah, thank you so much.
And I'm gonna just put a plug in. There is a medical student interest group for the AMSSM. So try to at least follow them on social media, because they put a lot of good webinars as well on specific sports medicine track of education. And on the website of AMSSM, if you are a planner and would like to see the potential sports medicine programs, there is a fellowship tab on the AMSSM website that lists all the fellowship programs by states. And you can also figure out which program, it gives you information on which programs accepts what kind of specialty. So there are programs that says, okay, this program traditionally has been taking family medicine, emergency medicine, pediatrics, IM, and also PM&R. That'd be the whole gamut. So remember, 5 specialties can go into sports medicine. And primarily the biggest specialty that goes in sports medicine is family medicine, but the second biggest is PM&R.
All right, it looks like we got a couple questions in the chat. The first one was from Allie, and they said, thanks for speaking with us. I wanted to know if it's common for PM&R sports med fellows to exclusively practice sports medicine or do a mix of both sports medicine and PM&R.
Yeah, I think that it really depends on your goals. And I think we could probably combine this with the next talk as well in terms of work environment for a sports medicine physician, how that may differ by specialty. So that's one of the really cool things about sports medicine is that you've got a really diverse group of people. A lot of times you might be in one specific building where this is our sports medicine center if it's like a big university. Other times you might go work in private practice. You might be working alongside a lot of orthopedic surgeons in an orthopedic surgery group. So that really depends on, I would say, your background and also your goals. Sometimes people may say, I also I'm really good at treating low back pain non-operatively, and I like doing spine injections and things like that. So some people really want to incorporate that low back pain aspect into their career. Someone like me, I'm not as interested in that, and so I'm more interested in kind of working for a bigger group, doing a lot of ultrasound, diagnostic ultrasound procedures, and ultrasound guided interventions. And so that really is kind of a product of what you're used to, what you feel comfortable with in your training. You know, that's usually what you're more interested in and what you're better at. And then you can also kind of filter jobs that way. You know, if you say, well, I'm mostly managing kind of knee osteoarthritis, which is a super common component of sports medicine, with just common things being common. You know, if you say, well, geez, it looks like this practice, that's kind of all you do, whereas I want a little bit more of a diverse practice. Maybe I go off and do some EMGs and nerve conduction studies every Wednesday afternoon. That's kind of the nice thing about being in a field that's really flexible and has a lot of kind of different strengths, such as PM&R, is that you can incorporate some of that general stuff that you learned during your residency. I know in like radiology and even like orthopedic surgery, they say, well, if you spend a 1-year fellowship doing this or that, you might spend 50% of your time doing your fellowship stuff and the other 50% doing more general stuff. And so you can kind of take that aspect of things as well. So you might be doing 50% sports, you might be doing 25% kind of general musculoskeletal care, another 25% doing maybe low back pain care or doing EMGs and nerve conduction studies, just as an example. Some people do a mix of inpatient, outpatient stuff. You know, if you want to keep that inpatient skill set up, you can certainly do that as well. So it really just depends on you know, what your goals are and kind of what your employer wants out of you.
This is kind of a general question, and it might vary from state to state or city to city, but are most sports medicine positions after you finish fellowship connected to like a major academic center or hospital, or is private practice like a larger share of the sports medicine doctors?
Oh, definitely. I can answer this. Like, yeah, so it's right now I can answer this really well because I'm applying for jobs. So there is, as a sports medicine physician, you can choose to go into the academic route. You can choose to go into the private practice route. And there are certain practices that are even like pseudo academic, as in like it's a private practice with an affiliation with an academic institution. So what does it mean to be academic? So academic, as you guys probably know, you have to be affiliated with an academic institution with a program, essentially a residency program, maybe a fellowship program, a medical school, a hospital that it kind of fits the criteria for the public service loan forgiveness. But academic institutions are ones that kind of they built into your schedule into either teaching or doing research, but not just a procedural heavy or a sort of a revolving door of patients kind of lifestyle, which is private practice is more of like that revolving door. You're there to do your work, but you're also going to be doing your work of seeing a lot of patients, doing possibly a lot of procedures, but not getting that sort of the set time for either teaching or set time for either doing research. The pseudo academics out there, they kind of incorporate a little bit of both with the private practice, but then the affiliation, you kind of sometimes with the pseudo academics though, you have to kind of make time for the academic portion of that career. So you have to, it can be hard and can be cumbersome, but yeah, there's different kind of environments that you can certainly be in.
Do most candidates fresh out of fellowship tend to work for academic centers versus private practice, or is it kind of just what's available in your area?
It really is what's available in terms of, I mean, at the end of the day, it comes down, at least for me, and I can maybe agree. Sometimes it's geographically, like you want to be in a set place, and geographically is either you're there at the right time when they're hiring in an academic institution, and you're kind of there, and they need a sports medicine physician. It's a perfect fit. But most of the time, it doesn't work like that as easily as you think. I've heard stories of people who there's actually the consultants or attendings that in our institution that work primarily in private practice first, and they transitioned into the academic practice of Mayo. So being in private practice in the beginning doesn't necessarily close the doors. If anything, it's just sort of like a stepping stone into going into academic practice when a position is open.
That makes sense. Thank you.
Yeah, for sure.
Anybody got any questions? That are experts here.
Hunter, I don't think we can hear you.
You hear me now?
Yes.
Okay. I'll just say, does anyone else have any questions while we got our experts here?
I mean, I have one more other question too. So other than the ultrasound guided injections for like steroids, are things like PRP or prolotherapy like becoming more popular? And is there a lot of evidence behind those techniques, or do insurance companies, I guess, kind of allow people to administer those things in a covered basis?
That's our bread and butter. So yeah, so Ike and I, we are in a fellowship that really does a lot. We specialize a lot of ultrasound guided procedures, but we're really happy that we're in a fellowship that also trains us on the evidence-based use of what we call orthobiologics. So platelet-rich plasma, PRP, is now kind of the biologic that is being very popularized as now the second steroid injection. So platelet-rich plasma in itself, evidence-based, has shown some good studies for joints and for tendons. Particularly, they work in trying to kind of help with the healing process. It doesn't necessarily create any sort of like cells or anything like that. There's also stem cell treatments, but it's really kind of create a good healing environment for that injury. In general, for insurance, there are certain insurances that are now starting to cover platelet-rich plasma because there is good evidence behind that. There's a insurance here at Mayo, actually, that's Mayo Health Insurance, that is covering platelet-rich plasma for patients. But most of the insurance outside of, most insurance companies do not really cover biologics yet. At this point, there are a whole gambit of injections that, other than the corticosteroid injections, that we can that are considered at that orthobiologic or regenerative medicine. We have that platelet-rich plasma. We have the stem cell treatments, and the stem cell treatments can go from like adipose stem cell injections and the bone marrow concentrate stem cell injections, which we perform here at Mayo too. So it's great to have, if you're interested in those kind of like cutting edge aspects of sports medicine, definitely try to make sure that a program also includes that. So certain programs don't even include biologics in their training. So at least personally for me, when I was looking at programs, I'm trying to make sure that the program itself had some exposure to biologics, had exposure to ultrasound guided injections. More importantly, I emphasize more of the ultrasound guided injection, because in the end of the day, if the research says XYZ is the injection to inject, in the end of the day, the ultrasound never changes, right? You put a needle in a patient, it's the same sort of technique. You're just injecting whatever it is. So we really kind of are really content that our programs really have that kind of a procedure and biologic exposure.
Yeah, just to follow up on that, Gio, I completely agree. And, the kind of scope of what injections are effective and what might not be, is always evolving. There's a lot of research being put into, is there something that can cure arthritis? Essentially, whoever invents that is going to really help a lot of people. But also on a similar note, the scope of what we can do under ultrasound guidance is also constantly expanding. So they're starting to do things like carpal tunnel releases under ultrasound guidance, fasciotomies for chronic exertional compartment syndrome. There's new research out that they can kind of do these mini ligament repairs in people that have chronic ankle sprains and ankle instability. So that's also something that is very useful, and that kind of speaks to Gio's point of, you know, having the anatomical knowledge and having the ultrasound knowledge. If you're familiar with that, you'll kind of always be equipped with whatever new technique or new injection is being developed and researched.
Yeah, thank you. It also sounds like a really interesting area that people could possibly like do research into as a resident or a fellow.
Yeah, absolutely.
Looks like we had a couple questions in the chat. First one's from Justin. Thank you both for your time. Were either of you considering any other routes to sports medicine, such as like EM or FM? If so, how did you make the decision to pursue PM&R?
Yeah, so I kind of liked everything as a med student. Maybe not everything, but I liked emergency medicine. I liked aspects of family medicine. I liked radiology. I thought the musculoskeletal aspect of radiology was really interesting. I liked some of the stuff that they did in anesthesia. I didn't love the OR, but I liked the musculoskeletal aspect of like orthopedic surgery. So then I kind of discovered I met some mentors that did ultrasound guided procedures, and I immediately fell in love with it. And so that was, I kind of asked them, you know, what'd you do to get to this? And they mentioned PM&R, and I wasn't really as familiar with that as a med student because like Gio, my med school didn't have a PM&R residency. So the more I kind of learned about that, the more I just went down that path. So, you know, as you guys are going to discover, there's good and bad things about every decision, right? And that can be daunting, but it can also be, you know, liberating. You know, there's not one best way to go about something. And so I think as you rotate through different rotations in med school, you know, just keep an open mind. You'll kind of find out, you know, what those personalities are like that you really agree with. And you know, your priorities kind of change over time as well. You know, plenty of people go in interested in sports medicine, and then they see the way that things work on the spinal cord injury rehab unit. And so, you know, you're never locked into a decision, but you know, obviously it's nice to discover what you really want to pursue early on. But I would also encourage to keep an open mind. And that's one nice thing about PM&R is that you can incorporate a lot of different stuff into your career. It's just kind of what do you want to be, you know, a super specialist, or do you want to be kind of a jack of all trades? And so, again, those priorities kind of develop over time. And, you know, you might think you really want to end up in this geographical area, or you really want to work for people that do a ton of research in ultrasound procedures, or, you know, spine care or traumatic brain injuries. And so that kind of develops over time, and you eventually land in what you're most interested in.
Yeah, and I can share my experience. I went as a medical student, really open-minded, like Ike was saying, and I got into a research project actually during MS1, between MS1 and MS2 year, with it was a sports medicine research project, and I always had the idea of like I really like anatomy, and maybe sports medicine and maybe orthopedics would be the trajectory for me. And I did a research project on ACL. It was an ACL prevention, and as well as it was a hinge ankle brace project, and really cool kinematics lab at University of Florida. But all in all, my principal investigator was a physiatrist in sports medicine. And he just blew me away. First of all, I did not know that there was a field of physical medicine and rehabilitation. I didn't know that there was such sort of non-operative sports medicine fellowship that you can get into with PM&R residency. So he kind of opened my eyes into the potential of what PM&R was. But I had the difficulty personally with not knowing what the residency was like, because I didn't have a PM&R residency in my medical school. So that's why the away rotations were super important for myself, because it solidified what I wanted to really get myself into for physical medicine. And once I realized, wow, I really enjoyed my time at traumatic brain injuries, really enjoyed my time in spinal cord injury unit, spasticity management, being a neuromuscular specialist, essentially. I chose PM&R with the idea of ultimately going into sports medicine. And it really is like you become, even though we're all trained, at least for sports medicine fellowship, we all take the exact same boards. We're all trained in sports medicine fellowship. It's just that the subspecialty, the base specialty is the different kind of flavors, the family medicine, the pediatrics. They provide the primary care aspect flavors of sports medicine. We try to get that exposure as well, but we bring to the table the musculoskeletal knowledge, the proceduralist, the procedures that we get from training in PM&R. Emergency medicine, man, they get procedures, but they also get the emergency aspect of medicine, of the urgent kind of things that you have to kind of make sure the patient gets through. And then internal medicine can also go into it. So it's really nice that we have such a different kind of flavors of residency programs that can go into PM&R, and you get to meet all of them at conferences. So I have friends in the family medicine programs. I even met people in IM who are IM and EM trained that are sports medicine. So it's really nice to kind of get their perspective on their training. And also just remember one more thing, just to kind of to let you guys know how this fellowship works. Once you're in a fellowship, you have to dedicate at least a half day a week on your primary specialty. So for example, like us PM&R, we dedicate a half day in PM&R, but fortunately in our program, our half day is just more sports medicine, because in primary PM&R, we include sports medicine as one of the core rotations. But family medicine people, they have to do sort of maybe some primary care aspect of their training. Emergency medicine, they have to incorporate emergency medicine things in their fellowship program. So it's very much like, if you are content with the primary specialty and really kind of like give your 100% to the specialty, then it makes things much easier in terms of like, okay, I'm content being a physiatrist in sports medicine, if that makes sense.
Awesome. Next question is from Jackie. Thank you guys so much. I want to ask you about what experience or opportunities you recommend being involved in, such as like conferences and researches and etc. That you found kind of most helpful when you're applying through residency and building your resume.
I think
Great question, Jackie. Obviously, priority number one is to do a good job in school. Get your grades, do well on your tests, have a life outside of school as well. But I think that things you mentioned are all good things to get involved with. I don't think you have to, really go crazy on getting involved in research projects and conferences. But if it is something that you have the ability to get involved in, starting off and seeing what research is like is always a good idea. Getting to either a PM&R conference or a sports medicine conference or whatever it is that you're interested in, maybe getting to one of those as a med student. It's certainly not a requirement, but it's certainly something you can get involved in. And the way to really do that is to, like we said, find a mentor, ask them if they're involved in anything, if you can help out with anything, things like that. But it can certainly help. It won't hurt, but probably not a requirement.
So I was also chief resident in Emory. So I reviewed applications consistently of medical students who are applying to PM&R. So I think one of the best things best advice, as well as if you're trying to be competitive in this field, is consistency. It's not just doing one sort of case report and calling yourself research. It's not just being part of having one sort of extracurricular activity that you did one time a year. It's more of consistency, that it's seeing that things that you love, that you are consistent on doing. In terms of research, it's nice to see a project that you start from the get-go throughout your time in medical school and then had a product at the end, or working on a product at the end. It's nice to see that if your medical school does not have any PM&R exposure, you went along and tried to do an away rotation. You went along and tried to create a specialty interest group or participate in a specialty interest group in trying to gain more exposure. And then also like Ike said, just kind of get good grades. It's more and more, it's getting competitive. Like I was told when I was applying, it wasn't as competitive, but it was still getting competitive. And then as the year has progressed, years have gone, it has become more and more competitive. I keep hearing, and I'm like, oh man, that's craziness. And I know it because I've reviewed the application. I'm like, you guys are all rock stars. So definitely consistency is going to be key in terms of trying to get yourself into being competitive and putting yourself out there.
Next question from Nick. Are the ultrasound guided carpal tunnel releases, ligament repairs, etc., part of standard practice in PM&R? And where can we find out more information on some of the newer techniques and procedures that are coming out in the field?
Yeah, a lot of the higher level stuff, like the involved procedures and things like that, that's not as common and that's not as standard practice. You know, that's if your goal is to be more on the cutting edge of things and be involved with new research and new techniques, you know, there's certain big usually academic institutions that are involved with that. Whereas if your goal is to, you know, maybe be in a smaller city or smaller practice, see a wide array of pathologies, kind of be more of a generalist, then you might be getting some of that stuff, you know, a couple of years after it initially comes out. And so again, that's really part of the goals discussion. You know, is there a certain geographic area that you want to be involved in? Do you really want to be in private practice versus academics? How much of a specialist do you want to be versus a generalist? And so that's very dependent on where you're at. Usually that stuff is coming out in the bigger journals. So the big sports journals, the big PM&R journals is where you really first hear about that sort of stuff. Otherwise, you kind of hear about it throughout your training as it comes.
Next question from Kate. For students who medical schools have a PM&R residency, would you still recommend doing an away rotation? And if so, any advice on like choosing and applying for those?
Honestly, if you have the exposure of a PM&R residency, I mean, it depends on you. If you like to use you can also utilize the away rotation on feeling on how other program, how they work. And geographically, if you're interested in a program, it's nice to kind of get an away rotation and have them see your face and see them work with you and have them work with you. And I think that is one thing that really I appreciated when I was at Emory. I got to work with away rotators and kind of get them some exposure on how we do things. And some people, they certainly had programs in their home institutions, but it's nice to also see different programs and how they do things differently. Some programs are a little bit more inpatient-y, and some other programs are more outpatient exposure and proceduralist, and some even and definitely programs do different have curriculum styles. So yeah, I mean, if it's worthwhile to do it, and also you got to remember it also sometimes it's out of pocket cost. If it's feasible, it'd be nice to kind of do an away rotation too.
All right. Next question is from Ashley. Thank you for speaking with us today. What does your patient population look like as sports medicine doctors? And do you have a particular type of patient population or sport that you hope to work with in the future?
Yeah, so that again can vary a lot in terms of what practice you're in. So I'm up in Minneapolis, and so we work with the Timberwolves and the Lynx and the Twins. So we have a lot of pro athletes coming through the clinic on a regular basis. I help take care of a Division III school, and so I'm over in their training room every Tuesday. But obviously not all places are like that. You know, a lot of sports medicine programs are affiliated with you know, maybe a Division I or Division II academic university. Again, going back to that, how much of a subspecialist are you? You know, there's obviously not enough pro athletes or even college athletes to go around to fill someone's clinic all day, every day. And so if you're a PM&R background, you're probably seeing a lot of knee or hip OA and helping out with injections. You know, you might be helping the surgeons if they did a total hip replacement and they need an aspiration to rule out an infection, you might be doing some of that. If you're in a very neuromuscular heavy group, you might be doing EMGs. You might be doing back pain procedures or seeing people with chronic back pain, things like that. So that can vary really widely. And that kind of goes back to falling back on your general training. You know, if you came from a pediatric residency, you probably have a decent amount of general pediatric patients that you're going to see. Same with family medicine. If you're doing ER, you're probably working 3 or 4 ER shifts each week, and then doing a little bit of sports clinic as well. So that can vary pretty widely in terms of your training, where you're at geographically, what sort of institution you're at.
Yeah, the patient population in here at the Rochester site, it really is everybody. We see from the middle schoolers of Pee Wee football to high school football, Friday night lights, to weekend warriors who are training to do a marathon at the end of the year, to the chronic sort of musculoskeletal cases, but also with the flavor of like, hey, I've tried everything, doc. I've done every single injections. I really do not want to get surgery. Can we try anything that is not operative? And as sports medicine physicians here at Mayo, we also do a lot of ultrasound guided procedures, and essentially we can also do regenerative medicine, orthobiologics. So because of that aspect of, we see a whole gambit of patients. I cover a D3 school here, and also get training room experience. So what we call training room is basically, at least at the end of clinic, we go and transition to the training room at the college, and our athletic trainer sets up athletes who are either injured or have a sort of a question for us medically to kind of address. We do our physical examination. We have an ultrasound in our training room, so we can do a brief a ultrasound examination as well, and then come up with an assessment and plan on what's going on with our athletes. And it's a really cool experience, because you get a lot of acute injuries. You get a lot of injuries that you get to follow up with your athletes. You get really closer with your athletes because you follow them throughout the whole entire season. It's really nice as you follow them up. You can see them get better and they can play, and you see them play because you're also there on the sidelines covering. So it's a really nice sort of aspect of sports medicine that I enjoy. Get to see a whole gambit of patients, and then personally for me, I would love to if I had an ideal patient population, it'd be a nice 50-50 of like the chronic musculoskeletal of like, yes, it's the bread and butter sports medicine, to the true sports medicine, acute injuries, perhaps people that are in season in either from the intramural sports to even division college sports, and that'd be sort of the ideal patient population for myself.
Another question from Justin. What skill set do you feel you gained from a sports medicine fellowship versus pain or sports and spine fellowship for treating the patient population that you're describing, such as the weekend warriors and athletes?
Yeah, so again, that'll kind of depend on the strength of the sports medicine fellowship that you're in. Gio and I do a lot with ultrasound guided procedures, some basic procedures, some higher level procedures. We get a good exposure to training rooms, so being comfortable if you're doing any sideline coverage in the future, managing those urgent or emergent situations. And so that's probably the big things, dealing with athletes. There's a lot of politics in higher level sports, and you have to be able to navigate those, whether it's, working with a coach or working with an athletic trainer or physical therapist. The pain medicine fellowships are going to be more probably chronic pain based, spine based. They certainly do a lot of really cool high level procedures as well, but they're also managing, depending on the pain fellowship, they're also managing chronic pain. They might be rounding on inpatients in the hospital, dealing with pain pumps and things like that. The sports and spine fellowship stuff is kind of going out of style. The ACGME accredited you kind of have to be one or the other, pain or sports. There are certain sports fellowships where they might have more of a pain flavor. There are certain pain fellowships where they might have more of a sports flavor, but in my mind, that's kind of an extension of a general training. You know, I went to residency where we got a good mix of both. So if I wanted to do both, I think I could have gotten that just going straight out of residency. But a lot of big hospital organizations these days want you to be ACGME accredited in one or the other. And so with my true interest being sports medicine, ultrasound medicine, ultrasound and musculoskeletal medicine, that's why I chose to specialize in that way.
Yeah, and a little bit about the sports and spine. Even though it's not ACGME accredited, there is some accreditation out there that's called NAS, North American Spine Association, but there's a NAS accreditation that some programs have, and that can kind of clue you in what the kind of procedures that they do. They're really trying to emphasize you do more procedures and not of the chronic pain aspect of interventional pain. Usually the idea of sports and spine is usually the private practice sector for folks who want to kind of go into the private practice because of the fact that it's not ACGME accredited. So if you want to kind of like improve on your procedure skills and then interventional spine skills and not have the hopes of kind of going and pursuing academics, then sports and spine would then be a good option for you. Going back to also sports medicine fellowships, as we were saying before, there are different types of sports medicine fellowships. Even though there's ACGME sports medicine fellowships, there's different types. And when I say different types, there's very primary care heavy sports medicine fellowships. There's PM&R sports medicine fellowships, and it just depends on the core faculty that are teaching in these fellowship programs. The PM&R aspect of sports medicine in these ACGME accredited sports medicine that are PM&R, as Mayo is, we primarily are focusing more on the ultrasound guided injections, but there are also other sports medicine fellowships that are PM&R that are very proud of the physiatry background, and they incorporate interventional spine into your program, even though it is an ACGME sports medicine fellowship. So you can have a sports medicine fellowship that is a PM&R oriented sports medicine fellowship that includes spine, but is not in the extent of the spine injections that you get in interventional pain fellowships, not to the extent that you get in the sports and spine fellowships, but you still have a little bit of, I would say like a half day in interventional spine in a ACGME sports medicine fellowship. I know that's a lot that I kind of said, and it's like skipping like 5 steps of what you ultimately want to become into sports medicine, but just have a good idea of what these fellowships are all about.
Awesome. Thanks so much for y'all's time. I know I learned a ton, so I think everyone appreciated y'all's time. Any other last minute things that y'all want to share with anybody, or? I think y'all about covered
No, I think
everything.
just enjoy the process, guys. It's a long road, and so you got to have fun while you're doing it, and you'll meet a lot of friends and mentors along the way, and that's kind of what it's really all about. So
yeah, honestly, just take it step by step. Really, as medical students, kind of hone in. If you really truly love the field of PM&R, embrace PM&R. Don't just kind of go set into like, I want to do sports medicine, even though I was thinking that way. I really embrace the fact that I love the exposure of being a neuromuscular specialist. I love the exposure of this traumatic brain injury, spinal cord injury, the proceduralist heavy sort of specialty that I have as a primary specialty in physiatry. Embrace it, and really good luck to all you guys. You guys are all rock stars, and it was great chatting with you all.
Thank you so
Thank
much.
you very much.
Yeah, thank y'all so much. This has been incredible. Good luck in y'all's job hunt too.
Thank you.
yep, thanks, guys. Appreciate it.